Can the results of my cosmetic procedure be permanent?
A question I often get about different cosmetic procedures is if the results of a particular procedure we discuss will be permanent. While many medical cosmetic procedures can have lasting results, very few procedures, if any, are truly permanent. The face and other parts of the body continue to change throughout your life. I'll discuss the different factors related to the longevity of cosmetic procedures. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been practicing in New York City and Long Island for over 25 years, with a large part of my practice focusing in treating facial aging with surgical procedures like facelifts, cosmetic eyelid surgery, facial implant surgery. I also performed hair transplantation as well as non-surgical procedures like lasers for skin rejuvenation, injectable treatments like cosmetic fillers, neurotoxins, and our trichostem hair regeneration treatment for the treatment of male and female pattern hair loss. While medical cosmetic procedures can help address changes associated with aging, obviously aging itself cannot be stopped. For example, people often ask if wrinkles under the eyes can be treated permanently. While we can improve the appearance of wrinkles under the eyes with procedures like laser resurfacing and PRP to improve skin quality, doesn't mean that lower eyelid skin is no longer subject to normal aging, environmental exposure, and a person's lifestyle choices after treatment. People who ask about permanent results are often unaware about how their general health and lifestyle impacts the longevity of their treatment. While aging changes are unavoidable, there are lifestyle factors that can actually accelerate the effects of aging and accelerate having an aged appearance. These lifestyle factors that can make someone look older than their age include excessive alcohol consumption, smoking, poor diet, too much sun exposure, severe stress, and even chronic lack of sleep. Simply stated, what's happening on the inside very much affects the appearance on the outside. During consultation, I often discuss potential longevity of results rather than permanence. The benefits of some procedures do last longer than others. Lower eyelid surgery, for example, has very good long-term benefits and can last over 10 years. The reason for this is that the herniated fat responsible for under-eye bags are in specific compartments. The appearance after fat has been sculpted tends to be stable as the fat left behind is in other compartments which have not herniated. I've seen patients who I treated in the early days of my practice state 2 decades later how their eyes still look great. Depending on the age you are when you have under-eye surgery, bone changes and some limited fat prolapse can be addressed years after surgery for under-eye bags has been performed. Injectable fillers as a category is a place where the desire for permanent results have had too many disastrous outcomes. For example, there are semi-permanent and permanent fillers available, such as those made with a material called polyacrylamide. Although these types of fillers can have very good, successful clinical trials for regulatory approval, it doesn't change the fact that this type of filler cannot be easily removed if a complication were to happen. Permanent filler materials can cause foreign body reactions, or if infection occurs, surgical procedures will have to be performed to remove the material and the tissue the material is infiltrated in. In contrast, hyaluronic acid fillers provide long-term benefits and are safely metabolized by the body. Hyaluronic acid is naturally present in the body, so these fillers are effectively hypoallergenic, making foreign body reactions very rare. Hyaluronic acid fillers also don't require surgery to be removed generally, as they can be easily dissolved with the enzyme hyaluronidase. Hyaluronidase also occurs naturally in the body. It is important to remember that our bodies, particularly our faces, are not permanent. One of the first signs of facial aging, which becomes more significant in the mid to late 30s, is facial volume loss. With aging, facial structures such as muscle, fat, soft tissue, and most of all, bone progressively diminishes with age. Many people assume that facial implants, for example, such as cheek implants, are permanent because they don't lose volume with time like fillers would. But your bone structure still progressively diminishes, and years after an implant was placed, many facial implants may look out of proportion and even appear more visible or have visible edges as you get older. We're living in a time when we can do more than ever safely help people look their best at any age. The benefits of some procedures do last longer than others. In my opinion, with so many options and overwhelming marketing, anyone considering cosmetic enhancement should have a trusted physician to be their guide. A treatment plan focused on your safety with maximum longevity can help you look your best for the years to come. I hope this information from my experience helped you. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.